Good afternoon. This is a presentation on a very difficult subject. We all seem to know a great deal about it already, but there is no structured write-up on this. And so we all interpret this subject differently in our own ways. Without much ado, let me just put in the PowerPoint slide so we can talk about it and see exactly what we understand by medical professionalism. So, medical professionalism is a ongoing attribute of medical practice, which was highlighted as a result of significant failings on the part of doctors. So various inquiries took place, and it appeared that it was found that there was a paternalistic attitude on the parts of the healthcare professionals, which impeded the image building of the profession and also did not help with unified regulation. And so, of course, there were many instances where lack of consent led to a charge of assault, and this led to criminal convictions. Similarly, not being aware of the computer and internet and online documentations was not held to be, they were not held to be appropriate excuses for doing manual paper writing of clinical notes. Then there were huge compensations awarded in cases of clinical negligence where professionalism was at fault. And for all these reasons, an inquiry was set up following the Bristol Royal Infirmary disaster, and the lead person of this inquiry held NHS accountable in as much as he stated that NHS has a club culture, it has a blame culture, and it regarded dealing with a complaint as character assassination, and that there was no awareness of organizational failure and organizational duties. And so it then appeared that systems were put in place for knowledge and skill upgrading of doctors on a regular basis. And it was held both by ethical bodies and as well as court of law that the profession of a doctor required the doctor to be honest in respect of explaining his success rates, failure rates of surgical procedures, that the doctor was trustworthy in being confided personal information, which would be made use of for clinical management of the patient. The GMC put in good medical practice rules which bind all registered medical practitioners into remaining compliant on such rules. There were tests of ongoing competency that were made available in the form of appraisal and other requirements. So these would keep the doctor updated and competent. Differences in the duties relating to family practice, particularly as a salaried doctor or as a partner, were defined by the PCT and then by the CCG, which through NHS England and related bodies ensures confidentiality, privacy, and maintains dignity of patients by adhering to equal justice, irrespective of race, color, religion, or belief. Patients were awarded the due dignity that they deserved. teamwork was identified as essential in producing a good medical care of patients. This led to an improved respect of the doctors, and therefore public started to feel that doctors had learned their lessons and that these were class of people who were highly recognized as respectable and trustworthy. New laws emerged suggesting that as far as the doctors were concerned, it's the reputation of the doctors on the whole, which was very important, perhaps more important than the personal attributes of the practicing doctor. So image building, preservation of image became very important. So that if a doctor was found to be drink driving and was criminally convicted, it needed to be reassured to the members of the public and the patients that this doctor would go through rehabilitation program and would then pay the penalty of imprisonment or penalties, which would teach him a lesson, improve his insight, and therefore restore a degree of confidence. So whatever we do, we need to be seen to be professionals, and therefore we should act in a professional manner. So when we talk about attributes of professionalism, we need to define what professionalism is. And to tell you the truth, looking at various literature available to me, it appears that professionalism is another name of communications. How we dress up, how we present ourselves, communicates to the patients accordingly. So if we are dressed up in casual, have a floral shirt, trainers on our feet, it doesn't make us very friendly. It perhaps reduces confidence on the part of the patients to feel that maybe the doctor is not looking like a professional doctor. And so in the way we speak, we explain, we advise, would create an area of confidence and a degree of confidence on the part of our patients who would believe that the doctors have researched well, studied well, and have kept up with their knowledge to be able to advise appropriately. So this is one way of describing what professionalism, in particular medical professionalism, is. It signifies a set of values, behaviors, and relationships that underpins the trust the public has in doctors. Remembering that the other name for professionalism is communication skills. So we go on to explain this further. And so professionalism is a form of communication. It includes ability to communicate specialist knowledge, diagnosis, and treating options in an easy to understand manner. In other words, we'd be speaking the patient's language, speaking in lay terms which are jargon free, and that we are able to impart to the patient the value of consultation and advice. There are three important fundamental principles of medical professionalism. The first is that patient welfare is primary objective. The second one is that we should empower the patient to self-manage as much as is possible. And we therefore need to give honest, transparent, clear, understandable advice. And enabling patients will improve the doctor-patient relationship and reduce the burden on the NHS. The third principle is social justice. This means that the limited budget available to the NHS needs to be spent wisely. Should one spend most of it on a few patients who are poorly ill with oncological diseases? Or should we spend that money onto a large number of people in a reasonable manner? So best treatment for a few or reasonable treatment for all is the choice that one has to make. And the examples are that if a couple in their mid-20s with 2 children approaches the doctor to ask for fertility treatment under the NHS, then the doctor should take note of the fact that this couple is not primarily infertile and have children of their own. And with the age being in the mid-20s, there's a good chance that sustained trying could result in having more children. So should expensive investigations and expensive treatment be offered to this couple rather than be offered to someone who is in their late 30s, has primary infertility, and may be suffering from a treatable cause? Again, provision is now in place for a neutral, arbitrative board to take a decision based on values, submission of data, reality, and the finite funding available with the NHS. In other words, the doctors have created methods by which spending could be controlled and used in a more defensible manner. So there are 4 different ways, I apologize, in which we can assess the degree of professionalism in a given person. Personal conduct issues, professional conduct issues, competence and performance, and health and sickness issues. We'll deal with personal conduct issues first. How the doctor has conducted himself in his personal life matters. Currently, under the NHS rules, income must be published. Success rates of certain surgical procedures must be published. Failure rates must be published. Number of complaints must be published. And so how the doctor conducts himself in his personal life also matters. A doctor who is convicted of irresponsibility, such as driving offenses, parking offenses, such as indulging in social arguments, and so on, may carry that image into his profession as well. So how the doctor dresses, comes to the surgery on time or not, keeps himself involved with good communication skills, and so on, will lead to issues of his personal life which reflect on his professional values. In dealing with professional conduct issues, I feel that things which we should not have are more easy to understand than what we should be doing. So these are areas of misconduct which make us less than professionals. So inappropriate behavior, such as making rude comments, sexualized comments, um, appearing to ignore bereavement, and so on, will be noticed by the patient, and they would regard this behavior as unprofessional. Some of us, unfortunately, fail some exams and claim that we have passed it. This deception, when detected, will lead to a charge of dishonesty and will reduce the image of the doctor and possibly also that of the profession on the whole. Plagiarism, which means using somebody else's research data under your own name, making it look as if you've been the researcher, changing basic essential details, but maintaining the text belonging to someone else. This is plagiarism, and this is a very unprofessional action. By way of an example, if you look at the next slide, which will discuss competence issues, I have relied heavily on Baylor University Medical Center's publication of this doctor. So if anyone wishes to learn more, all they have got to do is to Google it. We all know that it is unprofessional to provide any form of invasive treatment without taking informed consent. And we have covered this ground more than once. So failure to take consent can lead to a charge of assault or battery, which is a criminal offense. And so professionalism demands that we are well ahead of consent and that we explain it well, both the benefits and the potential harms, and then proceed with offering medical care. Slipshod prescribing. That means prescribing so that the patient isn't upset. So if while suffering from a viral infection, a mother asks for antibiotics, and if a doctor does provide antibiotics, knowingly he may have caused some harm to the child. At the same time, if there is an anti-epileptic medication that the patient has run out of or is running out of, we should urgently prescribe it in the same brand name that it had been previously prescribed so as to tide the patient over. Prescribing properly also means prescribing the right medication, hopefully in a generic manner, and also in a sufficient quantity, and then reviewing the prescription at a set date. So in this respect, we are often approached by patients who are not happy with being prescribed a 2-month supply on a repeat prescription and request for 3 months or 4 months. The rules of prescribing are very strict. We take full responsibility as prescribers. And so if one prescribes a 4-month supply of an antihypertensive or anti-diabetic medication to someone who has then chosen to go to Spain where he normally lives or Portugal, then who is going to monitor his parameters, the dosage, the side effects, the interaction? So we prescribe to patients registered in our area and take on responsibility. This rule is so clear that when we register patients onto our books, we follow the rule that if the patient is going to leave our area for 90 days, we should explain the process of deregistration and then advising the patient to get registered with the nearest doctor in the area that he lives. And this is mainly because of professional responsibility. And in addition, doctors are paid by way of a head count. And if the patient has deregistered, they shouldn't be paid unnecessarily. And this is part of probity, which relates to professionalism. There are certain bounds of relationship which are allowed and which are not allowed. Improper relationships are sexual relationships with a patient, or using the guise of a caring doctor and leaning on a patient who would then bequeath their assets or properties or make generous donations, as was the case with some of the doctors who had eventually been criminally convicted in the past. So, doctor-patient relationship is a professional relationship, and this must be respected as such. There are other issues of probity, such as signing of certificates such as cremation form, sickness certificates, ID confirmation such as in passport forms. And so professionalism demands that we issue appropriate certificates and take responsibility for such issuing. We also have many patients who have health insurances in place, and with their consents, insurance companies ask us to declare ongoing or pre-existing illnesses with dates. And no matter how patient-centered we are, how caring we are, we need to remain objectively clear, transparent, and accurate. It is essential as part of professionalism to maintain confidentiality, remembering that doctor-patient communication does not have absolute protection. In other words, it's not absolutely privileged communication, and a court can demand to know of the contents. Now, professionalism also involves maintaining competence. That means skills. And so this is described by Dr. Kirk as professional competence is the habitual and judicious use of communication, knowledge, technical skills, clinical reasonings, emotions, values, and reflection in daily practice for the benefit of the individual and community being served. So it's very clear that if a doctor claims to be able to undertake surgery for minor lumps and bumps, then every so often he would be attending a course with his peers where there would be a consultant surgeon, nurses, and means of practice where he would relearn or update various suture materials, techniques of suturing, how to excise a lump, how to preserve it, how to send it on for histology, and so on. In the absence of such revision, it is possible that the doctor has not been aware of a new form of treatment, new form of stapling or suture materials, and therefore he is able to convince his patients that he has upgraded his knowledge and skills by having a certificate of revision. A doctor necessarily does not have to show his certificates of competence to patients. But if asked, he needs to do that. As a result of NHS inquiry, it has now become the norm for all registered doctors to undergo annual appraisal. And this is conducted by peers who are approved and trained, and they take into consideration a variety of domains of competences, such as knowledge, skills, and performance, safety and quality, communication skills, teamwork, and partnership, maintaining trust. And all of these can then be summarized by the appraiser who looks into acquisitions of this doctor over a period of 12 months. And so, therefore, when the appraiser appraises this particular doctor, he can convince the revalidation officer of the General Medical Council that this doctor has upgraded their competence well. And then they start working towards their next appraisal. So, in a nutshell, how a doctor conducts himself with patients and with colleagues can be seen usually through the eyes of professional conduct issues. So that is part of professionalism. Remembering that there are health and sickness issues which form integral parts of professionalism as well. So what are these? Do no harm is the first prerequisite of being a doctor. If a doctor is suffering from a communicable illness, which he can pass on to his patients or to his colleagues, he shouldn't be coming into work. Examples are COVID-19. There could be other communicable illnesses as well, such as infections of various kinds, hepatitis, HIV. And so these are issues that the doctor gives an undertaking that he does not have. At the point of entry, under most medical institutes, tests are done to confirm negativity of communicable diseases. And if there is a need, appropriate restorative vaccination program is introduced. And so we do not cause any harm to our patients or to our colleagues. Sickness issues relate not necessarily to objective physical illnesses, but to other illnesses such as mental health, addiction, and behavior disorder. So neither from the physical nor from the mental health aspects, we can cause any harm to our patients or to our colleagues, towards which we have a duty of care. And so these are essential aspects of professionalism. I will simply relate to you the Accreditation Council of Baylor College. When a doctor becomes a doctor, having graduated, he makes an undertaking that in becoming a doctor, which is a resident, he must demonstrate a commitment to carrying out professional responsibilities, adherence to ethical principles, and sensitivity to a diverse patient population. So the doctors on graduating are expected to show respect, compassion, integrity, responsiveness, accountability, and also to principles of professionalism. And these are enlargements of Hippocratic Oath. We know some essentials of these in any regulatory council in any country, but we need to adhere to it as such. So let us summarize. So maintaining professionalism requires personal image maintenance. You conduct yourself in your private and personal life in an impeccable manner. You create an aura of professionalism, and that you are not aligned with any activity which makes it look as if you may not be fair to all your patients. In other words, there should be equity, justice, making sure that you give no consideration to gender preference, and you are primarily responsible for patient care for the problems that the patient has presented. You maintain your performance in an upgraded manner on an annual basis so that there is sustained confidence in your upgraded knowledge and skill. When you publish, write up, or declare your research materials, they must be yours and put down accurately. Historically, there have been doubts raised about exaggerated qualifications which were not real, exaggerated experiences which were untrue, and this led to image damaging of the medical profession on the whole. For this reason, one needs to improve on communication skills as much as possible. Verbal skill, documented written skills, listening skills, being able to communicate through your attire, your mannerism, your composure, and be involved with the patient's distress by showing empathy. So there are many aspects of professionalism that we should be trained in. Feedback is an important aspect. Negative feedback is not character assassination. It should be regarded as a learning exercise, allowing us to concentrate more on certain areas which have been perceived by patients as unprofessional or less than professional or in need of improvement. Positive feedback should be copied and shared, and therefore one should keep on collecting feedbacks, which is a prerequisite of appraisal. We should be having a caring attitude towards our patients, but we need to show it as well. In other words, empathizing, helping a fallen patient, doing and indulging in good Samaritan act, not shedding responsibilities, coming to work on time, helping out our colleagues, sharing work, sharing time off, not debating unnecessarily with the patient who has requested a home visit. And so maintaining professionalism is showing responsibility of this profession. If a doctor sees something in a colleague which he perceives as having the potentials of future harm, such as breath containing alcohol, such as a doctor behaving erratically, possibly being an addict of medication or something else, we should not shut our eyes to it because the person in question is a colleague. Our primary duty is care of our patients, and this could be compromised. Also, we do not do any justice by ignoring, saying to us, he's a senior healthcare professional, he will learn soon. These are short-term things. He's going through a bereavement process or a relationship process. He will bounce back again. By the time he bounces back again, some harm would have taken place. So it is important to raise concerns to someone who is in a position to offer assistance, support, stop the harm, and to follow it up. And therefore, these are all aspects of professionalism, medical professionalism. Are there any disadvantages of practicing professionalism? Theoretically, yes. So you need to spend extra time in being professional and in maintaining attributes of professionalism. You have to dress up smartly, you have to maintain your upgrading of courses and skills, then these need to be done when you are not working, possibly over the weekends or when days you are off duty. Some of these require financial expenditure as well. You may need to buy extra books at your own cost, CDs, better computer, better communication systems, and therefore there would be financial cost. You may spend time away from family in upgrading your knowledge and skill. So extra effort is involved, and it's not just one-off. If you have attended a joint injection course and have felt confident about undertaking some new varieties of injections, then you need to go back to the course the following year in case there are updates, in case problems have been discovered. Professionalism slows you down. And so if you are going to document appropriately with safety net advice, it may take much longer than 10 minutes. So do you habitually delay your next patients? Or do you cut corners? Or do you find a way in which you can document more, such as using voice type, learning to do touch typing, and so on? Professionalism requires a doctor to spend some time on the profession as well when he's not seeing patients. And so work, personal life may be affected. And this is something we know of at the point of entry into medical school. And so these are aspects of professionalism which I thought I would discuss with you, explaining that it is not enough to say, I've been a doctor for 10 years, I've not had any real problems, so I'll be all right for the next 10 years as well. Times are changing. Public is now more aware of their rights. Internet is available to compare treatment and successes. Therefore, we have to evolve with time and increase our attributes of professionalism. In other words, professionalism, and in particular medical professionalism, is for life. I hope that this presentation has gone some way to letting you have a good idea of what medical professionalism is, how we should conduct ourselves in our personal life, professional life, how we keep up to date with our competencies and skills, and how it all affects our patients, and how we can maintain and sustain such attributes in a long-term manner. So Once again, there is no one single person who can claim expertise in professionalism. And I thought I'll put together some of these thoughts and ask you to generate some more thoughts and expand on this presentation and teach others. Thank you very much. Thank you. Bye-bye.